Hello, everyone. It's another day with your fertility specialist. On behalf of Alps Hospitals, I love to say a very big thank you, viewers. Yes, I know you know me right now, but just to tell you, my name is Ruth Ogogo, and I'm excited to be with you guys. On behalf of Alps Hospitals, we're saying a very big thank you to our dear viewers. Thank you for always liking our posts. Thank you for sharing. Thank you for always staying glued to your screen. Today is a continuation of what we had not last, or just on Wednesday. That's like 2 days ago. Yeah, 2 days ago. This is me referring someone go back and watch Wednesday episode just in case you didn't get to watch Wednesday. There's a lot that you missed. So I'm going to give you some more updates today, but you need to go back and watch Wednesday episode. We're speaking about male fertility, and we have that watched Wednesday. Yes, we still have our guest Wednesday. And for someone watching for the first time, we have Mr. Stephen Olarinde with us. Mr. Stephen, you're welcome.
Thank you for having me once again.
For someone watching, time might interest you to know that Mr. Stephen is an embryologist, not just an embryologist, one of the top-notch embryologists you could ever know. Yes, should I say now I can beat my chest on that, or experience over time has shown that yes, it's one of the best that you could ever know. He's the head of the embryology unit at Alps Hospitals. Mr. Stephen, good to have you once again. As we get started, Mr. Stephen is fully loaded to downpour everything that you need to clarify your doubts on. So please feel free to drop your thoughts, your comments, your questions in the comment section. Share this link with someone, call up someone. If you need to send data to someone that privileged to be able to watch, don't have data, please do that right away. So everyone is going to catch a glimpse here about to get. So now, sit back and enjoy the show. So we're back to you, Mr. Stephen, talking about male fertility. What about what affects the sperm? In our last session, that was we had some talk about when a man is fertile, and yes, when a man is fertile. Yes, I would also give our viewers the whole heads up from Wednesday so they can go and watch and get the full details. Yes, you have the full gist there. I'm just giving you highlights what we talked about on Wednesday. You can have full details there. So today now do what sperm is. So maybe you could sort of what the sperm is and what the structure is like, what it looks like. Maybe so people could just have a picture in their head of
Okay.
what it looks like.
So I think the simple definition of a sperm is that's the male reproductive gamete.
Okay.
And every man, normal man, has that. Now,
Okay.
whether you have it in normal conditions or
Mm.
in the other conditions now differs after checking.
Okay.
So basically, a sperm consists of the head. You
Okay.
expect it to be oval in shape,
Mm.
the neck straight,
Wow.
the midpiece tail.
Oh, wow.
So that's basically what the structure of a sperm looks
So
like.
aside this head that we still have, a man now still has something another head.
Yes.
Okay.
So normal sperm it's supposed to look like that because with two there are sperms
Mm.
with bent neck.
Oh, wow.
There's all
Mm.
these morphology issues that could arise due to maybe genetic, toxic chemical,
Mm.
or exposure to toxin,
Okay.
or yeah. So a normal sperm, oval shape in head,
Okay.
straight neck, the
Okay.
mid piece should be intact, and
Mm.
then the tail will be there.
Oh, wow.
So the tail should be straight because in
Mm.
some head you have some amorphous head, some
Mm.
pin-like head.
Mm. Wow.
So because the head carries the genetic material of
Yeah.
the sperm, that's the acrosome in which we mentioned last time about the globosospermia, where
Mm.
people that have those kind of conditions, the head is there, but the genetic material is not, is absent. So the
Mm.
head should be there. So imagine pin-like. What will the
Be like,
genetic material be like in a sperm
yeah.
that the head is pin-like? Bent
Mm.
neck. How will
Mm.
they swim?
Mm.
Short tail. How do you expect them to move? Two tails. That's
Mm.
double tail. Expect them to be. So normal head, straight neck,
Mm.
and a normal tail.
Okay, so viewers, I know that you have a picture now, a mental picture of what he's referring to as a sperm, and he has made us know that sometimes you could have some of them in their abnormal forms. So maybe you will tell us conditions in relation to sperm. I mean, what do you call it when the sperm is normal? What do you call it when they start having some issues? I know there are some terminologies that people they have some terminologies for those things.
All right. So a normal sperm
Mm.
after SFA, that's seminal fluid analysis,
Yeah.
where all the parameters, by the parameters, that's the motility, morphology, count,
Mm.
some cases vitality is
Okay.
and volume is being
Mm.
met. It's normozoospermia. Just from the
Okay.
word normal, the sperm is normal.
Normal. Okay.
But there are a whole lot of words there where sperm is not normal. For example, a sperm that is low, the count is not up to the required amount,
Yes.
oligospermia. That
Okay.
is if, for example, that's the only challenge that sperm is having.
Mm.
Now, if there are other ones like the morphology, teratosospermia,
Mm.
so there are some, if it's the motility, is astenosospermia.
Okay.
So
Wow.
if it meets the criteria for each range, depending, and there are some that didn't meet any of the criteria.
Wow.
So in terms of volume is low, in terms of motility still low, in terms of morphology still low. Then
Wow.
you put all these words together and it sounds
Mm.
big. Then you say
Mm.
it's
Mm.
oligoasteroteratosospermia.
Mm.
That's the
Wow.
condition the person is having.
Mm.
So, but when the condition is fine, it's normozoospermia.
Okay.
Then there's another condition when absence of sperm cells. So there are people like we talked about the myth that they feel is performing, is arising, everything is fine.
Yeah.
So you can be doing all that and what is there is just the seminal fluid. There are no sperm cells in the seminal fluid.
Mm.
So the fluid is like the lubricant that the sperms is in. That's how
Yeah.
it comes out. So in condition where no sperm absence of sperm cells, that is azoospermia,
Mm.
no sperm cell present.
Wow.
Yeah.
Wow. That's amazing. A lot to know. So, sometimes we hear that when a couple or when a man is suffering from low sperm count, they will tell them, just go and do IVF. That's the way forward. Or they'll just tell them, if you try IVF once, go work. So, now how do we? So, I know that you've talked about low sperm count. At what point now would you say so you would you recommend someone to have an IVF with a low sperm count, or once they've been diagnosed with that low sperm count, they just should have an IVF? Maybe they've been trying to achieve pregnancy or not.
So for IVF, we're in a career age. Let me start with that. Some people
Mm,
just want to give birth to their children quickly and rest. IVF provide that option.
mm,
So everything can be fine, and IVF is still an option.
mm,
So the woman may be fine, the man is fine. IVF is an option. You practically probably want multiple gestation or more
mm,
than one babies, like we
baby.
say it.
Mm,
So yes, you come into IVF. There are different forms in which that can be achieved. Now for the sperm, when the sperm is poor, you recommend IVF for them. But that is after because what we do in our facility is for every problem there must be a situation that is giving rise to that. So we always want to investigate to the root cause of that. So want
mm,
to know, okay, this low sperm count, where is it coming from?
mm.
We send for scrotal scan to see what the
Okay.
scrotum looks like. Are there any inflamed blood vessels there that could be varicocele?
Okay.
So, and you know, varicocele in the presence of varicocele in the scrotum, what that is doing is the blood coming into the scrotum, there's like a valve that controls the outflow. So when that valve is faulty, instead of pushing blood out, what it does is just to accumulate blood.
Oh.
So when blood is accumulated in the vein, you know, it's swollen, discomfort. That in the
Okay.
long run affects testicular performance and then
Oh, wow.
translate to having sperm challenge.
Challenge.
So what
Okay.
we'll do is we request for varicocelectomy where that is addressed and see after the operation how the sperms will improve. So and if it's azoospermia again, there's azoospermia of two types now.
Yeah.
There is the obstructive and the non-obstructive. So the non-obstructive, once there's azoospermia, we request for the hormonal profile of the man. that give us a picture of what is happening in the testes. So the result from these hormonals tells us whether whether it's obstructive or
No,
non-obstructive.
no, it's
So if it's
okay.
obstructive, there's a way out with that. The teaser or pizza can be done to where the sperm is aspirated from the testes,
Mm.
and then through IVF treatment is done for the couples to be able to achieve pregnancy.
Pregnancy.
So when
Okay.
the sperm is poor, we check to see why that is happening.
Okay.
Once we address that, sometimes spontaneous conception can
Could
happen once the
happen.
woman is
Wow.
fine.
Hmm.
Yes, but in the world of IVF, it's not just dependent on the quality of the sperm. You go to the woman now, you're looking at the endometrium, what her lining looks like. So the quality of oocyte she produces, her age, those are other factors. So for poor sperm, for poor motility, for poor morphology, and for
Mm.
poor DFI, for those that their DFI is high, it simply means the quality of sperms they have is not good enough.
So for viewers watching, I know that you're wondering what DFI is. He actually talked about it in our last session. That's 2 days ago. DFI, DNA
Fragmentation
fragmentation
index
index.
for
At
the
least I'm
sperm,
trying
yeah.
to catch up. So you could listen to that and you would have an understanding of what that is. Okay, so back to you, Mr. Stephen.
So all these conditions necessitate IVF. You come IVF, and then IVF is being done. Low
Hmm.
motility, poor morphology, and poor low count, low sperm
Yeah.
count. All these things you come in for IVF. Instead of sitting down wasting time, why not come in, have a check?
Hmm.
If it's something that can be corrected to improve the quality of sperms, that will be done. And if there's anything that will be done to still improve the quality we have now, it may not be in
Yes.
count, but the
Hmm.
quality you give us so that when IVF is done, there's higher chance of achieving success. And by the way,
Yeah.
IVF is not 100%
Hmm.
because a whole lot of factor comes into play when you're doing this thing. Quality of the gametes and all that plays another role. That's quality of egg and the quality of sperm you, the
Yes. Okay.
partner, are bringing. So all these conditions, they come in and then you analyze them, you treat
Hmm.
them, and then IVF is one of the best options there.
Okay, so before we get back to IVF, sorry. So,
Excuse
what
me.
are some of the conditions that actually affect sperm quality? Because I know I heard you mention varicocele.
Yes.
What are some of the
So
conditions so that people are aware that when they have these conditions, it could actually affect their sperm, and then they look out for it or they monitor themselves from time to time so they don't fall victim of these conditions.
some can be avoided, some cannot.
Okay.
Some from lifestyle,
Okay.
maybe if he's a tech guy, as they call them, or you work on a system, your laptop is always there. Um, the scrotum is the testes are very sensitive to temperature. Temperature
Hmm.
affects how they perform.
Wow.
Just a slight, as high as a slight as 4 degrees increase in temperature,
Mm.
can affect sperm production. So those are basic things that you can have a tabletop where you place
Yeah.
your system.
Mm.
Those that go to saunas and have all these hot baths, you find a way to minimize it. Those that wear very tight get loose very good ones. Then there are some ones that you can't avoid, like the disease condition that can happen, maybe
Okay.
cancer, for example.
Mm.
Person is spending too much, you can do all that, but those are things that can affect the sexual life of a man. Disease can like mumps,
Mm.
that can affect sperm production. Then for those that genetically there's a genetic condition, they are born that way. Of course, that's where once you go to the genetic level where that's where all those corrections are done. That's when the CRISPR comes into play. Where
Okay.
you go to gene
The
editing,
gene.
where that particular gene responsible for that is
Chopped
removed,
off.
chopped off, and so that can be corrected. So there's disease condition, then illnesses.
Mm.
Some illnesses, infections can go ahead
Wow.
to affect
Mm.
STIs.
Mm.
Unproperly treated STIs can actually
Mm.
go ahead to. So all these play a role in the quality of sperms people have. Then the bad habits that we have now, excessive alcohol consumption,
Mm.
smoking, all these things are exposed to reactive oxygen species
Wow.
that affect the quality of your sperms in the long run. So bad vices.
Wow, so a lot of conditions, and you're just wondering with all these conditions, will the sperm survive? Well, Now you mentioned moms, it worries me because a lot of moms, most times we it's very common with
With children,
children.
yeah.
And then I think that some of these parents actually manage these things poorly, not
Poorly, yeah.
knowing what the impact could
Impact on,
be
yeah.
later on in life. So this is a wake-up call to parents. You should monitor your children and treat infections. You never know the one that would actually be the children, because at that point you really don't know what's going on
Yes, you don't.
later on.
So when you
Because
get to
not too
reproductive
long
age,
ago, maybe about a month or two, I heard of someone that, I think they said, I don't know if it was an accident or he had a condition that's, I think, affected his testes. I think they said it now became shrunken,
hmm.
and then the
So
parents were
so
worried.
undescended testes can actually
Hmm.
lead to that. So for those that have male children, I think it's good once a while to just check if the two are there. So they
Mm.
may be born with that and they don't know, that they don't check. So you will not know until when the child gets to reproductive age, and then
Wow.
you notice all those things in which
Hmm.
the damage has already been
Been
done.
done. Wow.
So the quality of sperm that person will produce, what two is supposed to work to produce, you can imagine one doing it.
Doing
So definitely
it.
the quality of sperms is going to be
So
affected.
you see, there's a lot for you parents or potential parents. It's something you should not overlook. While you are treating infection, check for the balls in your male children, and let's be sure that it's not hanging. It can actually be corrected.
Yes, it can be
It can be
corrected
corrected.
surgically.
So you
Yeah.
don't allow them to just say it will eventually come down, and then the child grows up into an adult, and then at that point the damage has already been done. It could still be salvaged when they are still children. If you're worried about your children's fertility in the future, which I know is something that every parent should be concerned
Definitely.
about.
Yeah.
You all want to have grandchildren, don't you? So it's something you should be attentive to be able to prevent some of these issues that could actually arise from childhood. It's possible that a lot of people that are even having sperm issue, it's possible too that
Yeah.
they've been victims from
Yes,
childhood
from
and actually they
childhood,
didn't
yes,
know.
you cannot rule out that. Then there's
Hmm.
some that probably get exposed to because of the line of job they do.
Hmm.
Those that probably work in bakery, in paint
Hmm. Hmm.
manufacturing
Hmm.
company, those that work with pesticides.
Wow.
They contain harmful chemicals that can damage the sperms. And that's why when you're exposed to all these things and you're not protecting yourself in any way, that's the long effects you have. You can have good sperms at a very younger age, even
Yeah.
probably get someone pregnant, and
Hmm.
then much later, because you're exposed to these over a long period of time, they end up damaging your sperm cells and then affecting your reproductive life.
Okay, so now let's come back to I know someone that is ischemic might just be wondering, can I get a woman pregnant? How can I get a woman pregnant? And they might be wondering how to go about it, because it might just be something they are pondering. So this is it, that's the end of it for me and all of that. Maybe they just go and do a test and they tell them this, they thought it don't finish.
So for those as the person, someone that is exospermic, that is there is a solution.
Okay.
There is testicular rejuvenation.
Okay. Okay.
Yes, testicular rejuvenation can be done a couple of times to regenerate, to see, allow the testis to regenerate its cells and then begin spermatogenesis, sperm production. We
Hmm.
have done that and we've achieved success with that.
Wow.
Live birth and
Hmm.
pregnancy.
Hmm. Wow.
Yes. So testicular rejuvenation is an option for them. So testicular rejuvenation placed on some medications. We place them on some medications over a while. Testicular rejuvenation done a couple of times. That has shown some successes, and we as an institution have achieved success with that. So that's an option they can explore very daily.
Okay, so what if the person is producing sperm, but just that it's
Coming
not
out.
coming out yet? How?
That's the obstructive azoospermia. So
Okay.
teaser can be done, or PISA, where the
Mm-hmm.
sperm is taken directly from the testes,
Oh
and
wow.
then yes, the sperms are collected, and then in the lab we prepare the sperms, and then
Okay.
we treat the with the partner's egg culture.
So it has,
But
so the person
IVF is actually,
okay, so
yes,
IVF.
IVF. No, it's not something you do through
Maybe they'll
any
think they'll
other
just
means.
inject and
No,
put
no, no,
into their
no,
wife.
no. You
Okay.
can't inject and put in
Okay.
their wives,
Okay.
because in that condition you have different kinds of sperms. The matured ones, the immatured ones, the abnormal ones. So the
Okay.
sperm sorting has to be done, where the bad ones are washed away and the viable good ones are then picked, and that is only done through ICSI. By ICSI, I
In
mean
fact, that was one thing I was going to
intracytoplasmic sperm
ask you.
injection. So with that's the technique we use. In this case, you are doing the embryologist is doing the fertilization. So you collect these sperms, you prepare them, then you put them in the ICSI dish, like we say. Then with the ICSI machine, a good sperm is being immobilized and
Okay.
then injected into oocyte for fertilization. Once fertilization occurs, the embryos develop, and then the embryos are then transferred into the endometrium of the partner
So now you're
for
talking of
pregnancy.
ICSI. A couple of times, some people have asked me, "Do you do ICSI at Alps?" Or so it keeps him wondering: is it everybody that wants to do the ICSI? For are there people you select and say, "Okay, these people are for ICSI, these people are not for ICSI," and all of that?
So ICSI is not for everybody and
Okay.
it's for everybody. I
Okay.
think let me answer it that way. So ICSI can be done for those with poor sperms, for
Okay.
those like we just explained, azoospermia, where we aspirate the sperm. Then for those that want gender selection for family balancing,
Yeah.
ICSI will be done because sperm
Okay.
sorting needs to be done.
Okay.
For example, you're a family man, you have two boys like me, you want girl,
Girl.
and you don't want to just leave anything to chance. ICSI can be done. You have two girls and you need a male factor, a male child in the house. ICSI can be done. The sperm sorting will done,
Okay.
and then ICSI can be done. PGD. So after ICSI, these embryos are analyzed for their chromosome to see that they are normal and then they're
Yeah.
of the desired sex. Then over time, it's a complex process. It's not a straightforward process. So these
Process.
embryos involves vitrification and all those things, thawing where you bring them back, analysis, biopsy. So then you put back into the woman, and once pregnancy happens, the desired sex that you desired is what you get.
Wow.
So ICSI is not for everybody. For those who poor sperm, yes, ICSI. There are those that their sperm is good, but because for gender balancing, as we call it, or sex selection, they want a particular sex, ICSI can be done for them.
Okay.
Yes, but
Okay.
most times once the sperm is good, there is no any DFI percentage is quite good.
Good.
You just go and do the IVF treatment.
Okay, so for all those people that keep asking, I want people to do ICSI and all. You've heard from Mr. Steven that it's not like it has to be done all the time. When there's a need, that's
For
when
it, yeah.
it would be done. Yes, and they do it very high expertise. Okay, so people, I think that maybe from your experience over time, what's your counsel to men with regards to how they can preserve their fertility? Because I think a lot of people live carelessly these
Carelessly.
days, and then you see someone that is even 22, 23, and then they are just checking and they're saying the sperm is very poor. I was talking about just not too long ago, a guy that I am trying to remember what they said the issue was, that the testis was affected or
Uh,
something, and then they probably treated, or I don't know if they had a surgery or something, but they sure had a form of remedy, and
remedy,
then
okay.
when they were eventually checking, sperm was
Was
really
not
bad.
bad.
And then I'm sure you have this experience of people. So when they come to check, I'm sure you've had your experiences with seeing a lot of young guys that come and do test, and you're like, this guy just fine for face, so nothing. I mean, I know you
Yeah,
should have that
yeah,
kind of
yeah.
experience. So what's
That's
your
part of the beat. That is not by how big you are, by how handsome you are. No, the sperm quality is not looking at all that. The lifestyle, the exposure, maybe the work hazard, environmental factor. Those are all things that play role. So for people that have this particular that are exposed to all these things, if the economic power or the financial power is there, you advise them to settle down quickly. And yes, so that they can quickly try have their the children, because over time we discover when that is it, over time if it may be decreasing. Yes, over time it may be decreasing. So but the most thing is to get yourself checked. Let's know where you are. So if some that can be corrected or an intervention that needs to be done, that will be definitely be done quickly, and then the quality of the sperms will be monitored so that it will not be is when you need them, you need the sperms that you actually
yeah.
come and check, which is our own practice in this part of the world. Is when I get married, I want to know, okay, can I maybe after waiting for a few months or some years, that's when most times we don't even come check on time. That's the problem. Some men don't come check on time. Some have been married for long. Once there's this delay, delay over time, just come work in a reputable hospital. Come check, let them see what the quality of the sperm is.
Yeah.
If it's fine, then they know what they are dealing with. Probably maybe from the woman. That challenge could be from the woman.
Yeah.
So all these needs to come in play. Early checking. You just come into so that you can be assessed and checked.
Okay, so viewers, I hope you're noting all this down. Let's now you talked about the sperm. Let's talk a little bit about sperm freezing, because I know that over time there are some people that will just come, they want to freeze their sperm regardless of how the quality is. Do you think from your experience over time that all sperms are freezable? And then what's your counsel to people about when to freeze their sperm, considering where we are
Yeah.
now?
So thank you for that. So once there's a disease condition, maybe you're going for chemotherapy, which affects that. You can actually freeze your sperms. You
Okay.
just bring them in vials. We freeze them, keep them for you. When
Okay.
you're ready to use them, you come because when you go through chemotherapy, it affects all your reproductive life. So for those that want to freeze the sperm, of course, you come in, you assess the sperm, you look at the quality. All sperms can be frozen depending on the quality that you have. So, but definitely, whatever the sperm is, you'll be cancelled about that because another thing is when you're freezing these sperms, the ability to survive is another key
Yeah.
area. So, if you're freezing a good sperm, of course, they'll survive. But if you're freezing a bad sperms, the outcome may be different. So, yes, you come, we'll look at the quality of the sperms you have, then we freeze them. And if the quality are poor, then you advise for multiple freezing of the sperm so that you have a whole lot of vials to work with when it's time.
Okay, so viewers, hope you're noting that, and the sperm can be frozen for as long as you
As
want.
long as
You
possible.
know, while you were talking about sperm freeze, I actually thought of this. For I know it's not common in this part of the world where men consider doing a vasectomy, but I think that people going for a vasectomy should actually consider freezing their sperm, so they don't have to go through the pain of
Teaser
yeah,
when they need
yes,
children.
because I know I think I heard of someone that's in his first marriage, I think, yeah, in the first marriage he actually had spontaneous conception kids. I mean, he had kids by spontaneous conception, and somehow they were done. And second marriage now, he has already had a vasectomy, no sperm deposits anywhere. And then at that age he was trying to have a teaser pizza. Yes, the multiple times they tried to have IVF done with the teaser pizza sperm, they couldn't achieve pregnancy.
So
So probably if he had actually
so yes,
been
it's not out
counseled.
of place for people like that to just have a backup in case something like this
Yeah.
happen. So it's, before going for the vasectomy, probably freeze as much vials as you can. Then you go. So when the need arises, you have something to fall
To
back on.
fall back.
Yeah.
We really don't know. We don't know what the future holds, and you
Yeah, we
never
don't
know.
know.
You never know
Yeah,
what
you
what
don't know
tomorrow
what.
brings.
Yeah.
Yeah. So if viewers, keep your questions coming. If you have any concerns, please do well to drop it at the comment section. If you have, yes, from the last time we had Mr. Steven, we had some people that even had to book consultation and they had to come in person to as well see him. So yes, just in case you would want to also have more understanding about your male fertility, you could actually book an online consultation with the number being displayed on the screen, so you could have further confidential communication with the embryologist, and you could have the best of counsels. I know there are some people that have some questions about the drugs to take, about supplements. Do
Yeah.
supplements really help and all of that? I know some people might have that concern. Yeah, speaking of that, do you have something to say regarding supplements? Because some people feel like they want to take all the supplements in the
Supplement,
world
yeah,
and all of
yeah.
that.
There are supplements that helps in sperm
Okay.
production. The basic thing is understanding how spermatogenesis works.
Okay.
There are supplements. I'm not calling that out to
Yes,
market
of course. If not, everybody
anyone
will,
right now. So, but there are
they'll start
supplements that
buying.
works, but it's based on what we are seeing after the seminal fluid analysis is done. You don't just place someone on supplement for sperms without having a picture of what the seminal fluid analysis looks
Analysis
like.
is
So yes, there are supplements that are readily available to boost the sperm motility and then the sperm count. Yes.
okay. So viewers, hope you've noted that. So as we wrap up this session on male fertility, what's your final counsel to the men regarding male fertility and fertility preservation for them as a whole, or as whole beings? Yeah.
So for men in Africa, the adage is disease no they kill African man. It's when you're hit that you get checked. The advice is always simple: go get yourself checked, and once you're checked, or after you've checked, there's no need to lose hope. There are lots of options available down there. If you can't see anyone, you can come to us. We'll sit down with you, we'll walk you and talk you through this process, and then what those things you're trying to achieve at the end, with the help of God, that will be achieved.
Yes. So, viewers, this is you. You couldn't have gotten a better counsel. He has told us about that. Never assume everything is fine. Just go check. And yes, just in case you've been checked and they've identified a problem, you don't have to keep sinking or soaking in that problem. You could actually get good help from good specialists, good fertility specialists like you have at Alps Hospital. You could have good counsel, good explanation as to what you're dealing with, and the best of counsels will be given to you, so you're able to achieve your fertility. We've had a lot of people with their bad experiences, and I'm sure they've had their successes. They didn't keep sinking in whatever news that they've gotten. All is for you to seek help in the right
Yes,
place
okay. All
and
right.
get the right counsel. Yes, and be open, keep it open, take the right counsel, keep it open. Don't stick to your shell, or don't stick to your cycle and say, okay, it has to be my way, it has to be my way. Seek counsel, and the goal is for you to achieve your fertility dream. Yes, we're always rooting for you guys because we want you to achieve your fertility dream, and that's what ALP stands for. All we want to see you is have that smile, have your baby or your babies, and be happy. So please take it, every counsel that you get from here, or when you see your fertility specialist, in the best of your interests. Please be open to it and make the right decision. We hope that by virtue of this session that we've had 2 days ago and today, a lot of male fertility will be preserved. And for parents that are wallowing in ignorance, I know you've been enlightened from this session, and you have a rebirth, a reborn of the way you take care of your children, so you could have better fertility. So in 10 years to come, or in 20 years to come, maybe the SFA analysis would go up and not come down like
Hopefully, that's what we're hoping and trusting for.
we hope we get this someday. It's been amazing having you, our dear viewers. And yes, Mr. Stephen, we had a very, very insightful session with you. I know our viewers had a good time with you as well. Viewers, please keep staying glued to your screen, keep staying tuned to us, because we have a lot more coming your way. And we appreciate you all for joining. Please enjoy your weekend until we see you next time. Bye.